In 2020, the faculty at UC Davis Health, in collaboration with the eScholarship Publishing team at California Digital Library and Blaisdell Medical Library, released Ultrasound in Resource Limited Settings, a case-based, open-access text. This interactive online text aims to provide an open-access clinical resource for radiologists and clinicians who practice ultrasound in low and limited resource healthcare settings. The publication was CDL's first publication to be released on the Manifold platform and also represents the first project completed under the eScholarship Labs program at California Digital Library. We launched the eScholarship Labs program in 2019 with the aim of fostering innovation in scholarly publishing by piloting new publishing technologies to support experimental forms of scholarship. Manifold is now graduated from the Labs program and is available for use by any member of the University of California community who has a scholarly project in mind that requires deep integration of text and media. What follows is an interview with members of the project team who are here to describe their inspiration, process, and future goals. So today I am joined by Mike Schick, Associate Professor of Emergency Medicine at UC Davis. Welcome, Mike. Tell the audience a little bit about yourself.
Sure. So as Justin mentioned, I'm Associate Professor of Emergency Medicine. That means I did residency training in emergency medicine. I work in the emergency department at UC Davis and at the VA hospital as well. But after I did my residency training, I did a fellowship in point of care ultrasound. And then I ended up doing lots of global work through my residency and then my life after residency until now. And that's kind of what led me to this project.
We're also joined today by Rebecca Stein-Wexler. Welcome, Rebecca. Would you introduce yourself?
Sure. Yeah, I am a professor of pediatric radiology at UC Davis. And over the past 10 years, I've done quite a lot of outreach work in resource-limited countries where I've had the opportunity to participate in ultrasound studies.
And the project is called Ultrasound in Resource Limited Settings, a case-based open access text. Tell me a little bit more about your inspiration for this project.
Sure. I noticed in my work that we would use ultrasound in ways that it wasn't typically used in the United States. And so both doing different kinds of studies and also using it for different applications. Since CT is much less available where I was working, ultrasound was used to problem solve instead of whereas here we would have gone directly to CT. And so for people who are using it in unfamiliar ways, they don't necessarily understand how to interpret things because we don't see them routinely here. So I thought it would be really helpful to develop a resource that people both who routinely work overseas or who are temporarily there would be able to use to sort of be more familiar with different ways to approach the use of ultrasound and also the disease entities that you see in resource limited countries that you don't necessarily see here.
Yeah, absolutely. So I have worked in different places in Africa and Southeast Asia, Nepal, Central America, and I've taught ultrasound and used ultrasound, in the emergency departments, but in the wards of the hospitals and clinics. And early on, and even now, I just had kind of an absence of references that I could use for many of the diseases that we see regularly in limited resource settings that we hardly ever see in high resource settings like the United States. So I wanted to endeavor to create an open access, free resource that anyone could tap into anywhere in the world and learn about practical use of ultrasound in these limited resource settings.
And we ended up choosing the Manifold platform. But before you sort of learned that that existed, can you tell me a little bit more about how you sort of envisioned the project?
Yeah, I didn't want to make a traditional textbook because this project was not intended to be how to do ultrasound if you're a beginner, like how to do a comprehensive emergency ultrasound or abdominal ultrasound. It was supposed to be a case-based text highlighting those real heavy hitter disease states that you see commonly in these limited resource settings, and then have high quality images and videos available so that people can use them as reference. The resources that I had available before this, they're often very old images, still images in textbooks, paper textbooks, not even online, that weren't ideal when you're kind of in the field trying to figure out what's going on with a patient. So I was hoping to create some sort of online case-based reference that people could download and use on the go.
And like I said, we did arrive at choosing Manifold. What has felt like a good fit for this project for you with the Manifold platform?
Yeah, the Manifold platform really helped us achieve our goal because it allowed us to use a lot of media, so lots of videos, high quality images, allowed us to create different chapters, which are in the form of cases. And we're able to link all the videos, as many videos as we want within the text itself. And people can just freely look at those and download them, use them for teaching, keep them on their computer for later. So it's really been an ideal format where people can just click on cases, read them, download what they need. It also created a great kind of repository of images as well. So anyone can just go in, look at just the images themselves, just the videos, type in, search what they're looking for, and then use it.
Yeah, one of the cool decisions that your team made early on was, in addition to the videos, providing animated GIFs. And I think that also helps to serve folks in limited resource settings because bandwidth is sometimes a limited resource. So you're able to sort of see the movement of the images, even if maybe you can't get the whole video right away.
Yeah, we were concerned about the bandwidth issue because we've all experienced difficulty downloading even 3-second video clips, which is what is commonly used with ultrasound. We had to make a decision whether we were going to use just still images or animated GIFs. And we landed on animated GIFs because we just know that the videos are just so much more valuable than looking at still images, at least with ultrasound. So the animated GIFs are more data, more bandwidth than a still image, of course, but they're so much more valuable. So those are available, but also the video files, the original video files are available for everyone too. And I should mention the other reason that we chose Manifold is that it allowed us to create different versions of the text, because our overall vision was to really make this a truly accessible reference for hopefully everyone in the world. And so it had to be open access, it had to be downloadable, but also has to be readable by people around the world. So we tried to recruit translators to then take this text and put into different language versions so that it can really be used around the world. So at present, our first translation that we did was Spanish, and that's out in its full text form. And then we moved on to Portuguese. French is coming out just in a week or so. And then we have Italian and Farsi and a couple other languages kind of ready to go.
So Mike, can you tell me a little bit more about how you formed your team for this project?
Yeah, absolutely. So the project sort of came about with some conversations with myself and Dr. Stein-Wexler. We've both done some work in limited low resource settings. And I thought it was really important to have a physician like myself that does a lot of point of care ultrasound work, but also an experienced radiologist that's done a lot of work in limited resource settings. So we had this sort of balanced level of expertise, but also so we had contacts in different areas that will allow us to have lots of contributions to the book, because our authors for the cases and the texts are from a lot of different backgrounds, a lot of different specialties, work different places in the world. So that's one of the great things about this text. So we're the chief editors. We also have an online editor that does a lot of the work of putting everything, all the content online and making sure it all looks good and functions well. So that's Ada Nasiriyasharg, and she is be graduating at UC Davis as a physician shortly. We also have our digital team. So the whole team, eScholarship publishing team of California Digital Library, they sort of made this possible and allowed us to kind of host the book itself and allow it to be open access and free. Also, our Manifold team, primarily Terrence Smyer from the University of Minnesota, really helped make this happen too, because he brought that expertise about Manifold, kind of taught us the ropes and allowed the text to just be the resource that it is.
Now, one cool thing about working on this project with you is that we sort of got to learn Manifold ourselves as we were working on the project. So about translations, I understand that you were sort of coordinating the recruitment of the French translator. Tell me a little bit about how that process went.
I have done a fair amount of work in Haiti and have met a lot of medical people who are fluent in French as a result of that. I reached out to Yamilé Blain, who was a radiology resident at the public hospital in Port-au-Prince, and she had graduated by the time we were working on this project, but she seemed like the ideal person since she's very capable, very organized, and fluent in French as well as in English.
Hi, welcome. Thanks for joining us. Could you start out by telling us your name and a little bit about the work that you do?
Hi, my name is Yamilé Blain. I am an abdominal radiologist. I trained in Haiti, where I am from, and in the United States, where I currently practice. I have a very keen interest for global radiology and education in radiology in general, and I guess this is what brought me into this project.
And can you tell me, what attracted you to this project? What did you find important or interesting about it?
So I was approached by Rebecca about this project. I have a particular interest in ultrasound. I trained partly in Haiti, and I learned ultrasound there, and the project is everything that I've encountered in my training, and it was a great pleasure for me to take part in this and help put this knowledge out there. One of the reasons that I was very interested in that project is it's something that is very practical. There are a lot of books on ultrasound out there, and of course, a lot of them are very good. The reason that this project is particularly interesting is because it's real world cases that actually people who work in lower resources environment encounter daily, if not daily, but regularly. I feel like this knowledge is needed in a lot of part of the country, of the world, and can actually help advance the medical practice, the practice of radiology.
I understand that you are working on the French translation. Can you tell me how you're going about that work?
This was not one woman's work. So I recruited a team of 4 people. 3 of them are current radiology resident in the public hospital in Haiti. One of them is a medical student, and they are all fluent in French and English and very interested in research in general. So I thought they would be good people to work on.
So now that you've been working on this for a little while, what are your hopes for this work that you're doing?
I really do hope that this will be, once published, that it will reach people that can use the knowledge and that can, integrate it into practice. I also hope, I know there are a lot of translations in other languages, and I do hope that we will find many more people to translate it in as many languages as possible.
And that's all the time we have today. I want to thank Dr. Schick, Stein-Wexler, and Blain for sharing their time with us today. You can learn more about this project via the links on your screen, and we welcome your questions during Q&A.